Hello, everyone. Good afternoon, and welcome to our podcast today. This is a beautiful place to be. This is a place to talk about health related issues, some things you need to know about your health. So, today we've brought to you another interesting topic today. What I'll be talking about today is unhealthy practices that leads to infertility. And remember, I'm your humble host, Nurse Gift. Welcome to our podcast today. So today we'll be talking about unhealthy practices that leads to infertility. Unhealthy practices that leads to infertility. When I mean unhealthy, I mean those practices that you indulge yourself in that can make you suffer infertility tomorrow, even as a young lady. Some unhealthy practices that can make you suffer from infertility tomorrow, or even as a married woman, some unhealthy practices that can make you suffer infertility tomorrow. Now, we women, we young ladies, we are very used to some hormonal drugs, some contraceptive drugs. But too much of everything is definitely bad. We are used to buying drugs, over the counter drugs from the pharmacy whenever we are sick or whenever we feel that something is wrong with us or whenever you want to prevent pregnancy. But this happens to cause a damage in our body system. You may not see any damage at that time, but in the later future, you might start experiencing some different problems, which has been or which could be as a result of uh, what you've put yourself into in your younger age. So now the use of hormonal drugs or the use of hormonal drugs is not that good as a woman. It's not that good for you to use. Some persons end up using it and abusing it. Some end up using it 2 times in a month, which is very bad. They are hormonal drugs. What they do, they try to scatter your hormones so that you will not get pregnant, which is what you are looking for, which is why you are taking the drugs. But in the long run, it can make you suffer from fallopian tube blockage. It can make you suffer from what? Fallopian tube blockage. It can also make you have what? Scar tissues in your reproductive organs, thereby causing a big problem. When now you start looking for a way to get pregnant, you find out that you're having some challenges, you find out that you're having some problems. And also self-medication. Self-medication is totally wrong. As a woman, it is not good to indulge yourself in self-medication. If you are sick, if you are sick and you know that you are sick, it is very pertinent enough for you to go and see a doctor. Okay? It is very pertinent enough for you to go and see a doctor. You need to see a doctor. Then when you see a doctor, the doctor will advise you on what to do. The doctor will advise you on what to do, on the medications to take. You get that? On the proper medications to take. Because if you end up taking your own medications, you might end up endangering or causing problems for yourself. Okay? Then another unhealthy practice that we women engage or indulge ourselves in that may end up causing infertility tomorrow for us is what we call what? Dilatation and curettage. Dilatation and curettage. That is another problem or another unhealthy practice that we ladies indulge ourselves into. Now, the word dilatation and curettage, I'm just calling it like that because some persons might know it as an abortion. But it has now become a household name and a problem comes out that she will always find a way to get out of it. She will always find a way to get out of it. But uh, a problem might tend to come in the near future. You know, some intending couples, when you want to get married, there are a series of tests that are being advised that couples run before they get married, which includes blood group genotype, STDs, HIV, and S. But there is a particular one that we failed to know, which is what? HIV and AIDS, which is, sorry, Jesus factor. Now, Jesus factor compatibility is one of the tests ladies or couples should also run before getting married. Now, how does it play a role in this dilatation and curettage or abortion that I said? Dilatation and curettage, if you have sexual intercourse with a man and he happens to get you pregnant and you now went for dilatation and curettage or abortion, there is a deposit of the man's Jesus factor in your bloodstream. Remember, Jesus factor could be positive or it could be negative. So you don't know the particular one, the man deposited in you. You understand? He could be Jesus factor positive, while you are Jesus factor negative, and you two don't match. So because of that, now depositing he will end up depositing that negative trait in you. And if it is not cleansed from your blood system, once you get married tomorrow and you are looking for a child, problems tends to come up. That's why so many persons, they might get married and they are looking for a child. They get married and they're looking for a child, and problem here, problem there. You don't know what's coming, what's the problem, or you may be facing miscarriages, but you'll be asking yourself, what is the cause of these miscarriages? It could be as a result of what you've done in the past. A man could be Jesus factor positive, while his wife is Jesus factor negative. They don't match. But if you're Jesus factor negative and your husband is Jesus factor negative too, you two match. You understand? So now, if you get pregnant, maybe as a lady in your early adulthood or your early teenager, whatever, you get pregnant and you happen to go for an abortion or dilatation and curettage, and without even knowing whether your Jesus factor matches with the man that got you pregnant. You understand? So there's a deposit of the trait of that Jesus factor in your bloodstream. In your bloodstream, there's a deposit of that trait in your bloodstream. So now, because it is there and it doesn't match, in the near future, when you're trying to get pregnant, when you're trying to conceive, to finally bear your child, when you're trying to finally conceive, to finally bear your child, it now becomes a problem. The baby might not stay. You might have miscarriages because you didn't get that injection that will cleanse that blood from your bloodstream. Okay? You didn't get that injection out of your bloodstream. Okay? And it can even end up causing many damages or many defects in your baby, even if you eventually carry your baby. That's why we advise, if a couple is getting married and they finally get pregnant, the woman finally gets pregnant, and their two Jesus factor doesn't match, it is advised that the woman should take an injection immediately after delivery. Okay? She should take what? Injection immediately after the delivery, so that it will cleanse out of her womb, out of her bloodstream, so that she'll be able to carry her intending babies without any problem. You get that? She'll be able to carry her intending babies without any problem or without any challenges. So this is what we young ladies fail to know or fail to understand. It is not all about having dilatation and curettage. It's not about having that abortion. It's what comes after it. Because you don't know the Jesus factor of the person that got you pregnant, and you too, you don't know if it matches. So I advise people, it's not even only about doing that. Do you know the dangers that comes after it? So that is why we should be very, very careful about that. Now, what are the unhealthy practices again that we ladies or we men indulge ourselves in that can end up making us suffer from infertility tomorrow? Another one is the abuse of drugs. It is the abuse of drugs. You might have a particular problem and you go to a doctor and the doctor prescribes a particular medication for you. And at the end of that medication, you find out that you're okay. You've gotten yourself that you're okay. Then tomorrow again, you might be feeling something again. You'll not be like, the doctor gave me this medication. Let me go and buy it again and take. You keep on taking. So many women abuse drugs, even Clomid. So many people will tell you that they are not ovulating, they are not doing this. They'll end up going and buying medications on their own and be taking. They'll tell you, sometimes if they visit a doctor, you will tell them, have you taken? They say, yes, I've taken this. So what of this? I've taken it. So who told you to take? Do you know the dangers? Do you know the implications of those medications? Do you know adverse effects, because leave drugs has adverse effects. Okay, if you take it much, it has adverse effects. It can cause some damages, it can cause some serious problems. So that is why it is not good to abuse drugs. It is not good to abuse drugs. And also in the side of the males, please, it is not also to abuse drugs. Some do take some manpower drugs so that they can be able to perform well sexually and all of that. That is not good. If you know that you're not medically strong, you're not medically fit, that you're having one challenges or the other as regards to your sexual health, take proper medications. If you take proper medications, you'll be hell and healthy, and you wouldn't even need all of those drugs. You wouldn't even need all of those drugs. And also, coming to the male also, it is very pertinent cancer, and excessive alcohol consumption is one of the major causes of this prostate gland. Some people say it's because you're not having regular sexual intercourse. Who told you so? Now lie. It's a lie. Because you are not taking proper care of yourself. Your lifestyle is nothing to write home about. Excessive alcohol consumption, is not good. It's not good for your body. It can also end up making a man have erectile dysfunction. Erectile dysfunction. It is very, very good that you abstain from all these things, okay? These unhealthy practices. It is very, very good you abstain from them so that you live a healthy lifestyle. Then another unhealthy practice again to the side of the male is proper treatment of infection, or you can say improper treatment or not treating your infections properly. Some persons, they might have an infection, they will go to a doctor, or they might not even go to a doctor. They will say, I'm having an infection. Or they will just go to the pharmacy, get a drug. Once that symptom leaves them, once that symptom stops showing itself, they'll be like, yes, I'm okay now. I'm perfectly okay. There is no other thing I'm going to do, that I'm okay. You don't even know if that infection has cleared in your system, because some infections can be so funny. They can come with some signs and symptoms. And when you take one or two drugs, it will stop showing itself. Okay? It will stop showing itself. Then at that time, you might think that you are now perfectly okay, that you are now fine, which is not true. What it just did is it just went to hide itself in the body, which at some point in time, it can still come up. Even in the side of the female, once you have infections, do well to treat it. Don't take one or two medications, and when they stop showing the signs and symptoms, you'll be like, yes, I am okay, I'm perfectly okay now. Okay, it is not like that. Once you have an infection, go and do a test, a proper test. And when it's confirmed that you have an infection, do well to treat it. And you go back again for examinations to know if those infection, or if that infection has properly cleared from your system. That is when you will be able to ascertain that, yes, of a truth, that you fully treated infection and it has cleared from your system. Okay, then on another unhealthy practices that we do that may end up making us suffer infertility tomorrow is having multiple sexual partners. Having multiple sexual partners, that is very, very bad. As a man, as a woman, even if you should have a sexual partner, at least one person is enough, so that whenever you're suffering from any health challenge, you will know where the problem is coming from. It is not having more than one sexual partner that will make you an odogu, that will make you a real man. No, 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 no. It is when you have one sexual partner, and when you're facing any health challenge, you will know where the problem is coming from. Then another unhealthy practices again, that or the things that can help make us suffer from infertility tomorrow as a woman. Let me now come to it properly. As a woman, the things or the factors that can make you suffer from infertility tomorrow is age. Age. Some persons come to you and they tell you that they have not been able to conceive for like how many years in marriage. And when you get to ask them their age, they'll tell you, I am 40, I am 42, I am 45. Please, let me state it categorically clear. As a woman, once you reach 30, fertility begins to decline. your hormones, your progesterone, your estrogen. Mind you that all those hormones came to play a role immediately you entered puberty. Okay? Immediately you entered puberty. So once you now reach that 30 years, they will now start to decline. Okay? At least from 25, 28. Just know that a woman's fertility declines with age. We are quite different from the males. A man can be up to 50, 55, 60 and still be agile, and they still produce spermatozoa even at that age. Okay, so it is very, very pertinent enough as a lady, once you are trying to do anything as regards to your health, as regards to childbearing, know that you have to do all of those things in time, because fertility declines in age. Now, another thing again that can make a woman suffer infertility is what? Hormonal issues that prevent you from ovulating. Hormonal issues that prevent you from ovulating. A whole lot of women suffer from hormonal imbalance. Hormonal imbalance means too much or too little of the hormones in your body. Okay? You know, as a woman, we have the progesterone, we have the estrogen, we have the follicle stimulating hormone, we have the luteinizing hormone, we have the androgens, we have the many of them. But when they are now in excess, or when they are now little, okay, it becomes a problem. It becomes a problem, and they play an important role. Each hormone has a role it plays. Even in male, we have the testosterone, we have the many of them, we have the activin, we have the inhibin, many of them. So when you have too much of it, or when you have too little of it, it becomes a problem. And as a woman, you know that we have what we call the ovaries, and eggs are being produced in the ovaries. Okay, so when you're having this hormonal imbalance, it can make you to suffer what we call hormonal imbalance, and your eggs will not be produced. Okay, you will not be producing egg. And when you're not producing egg, how do you want to conceive? How do you want to conceive? Some women lactate, some women express milk from their breast, which is abnormal and is as a result of hormonal imbalance. So hormonal imbalance can be a contributing factor to a woman suffering infertility tomorrow. So that is why it is pertinent enough whenever you have, be it UTI, that's urinary tract infection, STI, sexually transmitted infection, any of them, it is very, very pertinent to treat them as soon as possible, so that it will not end up causing impending dangers to your health tomorrow. Now, another factor again that can make a woman suffer from infertility is obesity. Obesity. There's what we call body mass index. Your body mass index shouldn't be that too much that you are too fat. You cannot, your body will not even accept that this person needs a child. There's a particular weight you should be able to attain. Okay, because once you get pregnant, your baby even takes much weight. You now try to understand that you will still be adding more. So there is a particular weight you need to attain for you to conceive. Then even in pregnancy, we also advise that you also be monitoring your weight, so that at the time of delivery, it will be very, very easy for you to deliver your baby without no issues, without no problem. That is why some women during delivery, because of too overweight, they will tell you that this baby is overweight. You see a baby weighing 5 kg, you see a baby weighing 6 kg, and most of the times, some women that do normally have this problem is a woman, maybe it's her first time of delivering, and you see the midwife or the doctor giving her a episiotomy, giving her a cut just to bring out the baby, just because the baby is too big for her to give birth to the baby. So that's why we stress this one, obesity. Please don't mind your weight, mind what you eat. Okay, mind your weight, mind what you eat, so that you can be able to conceive and bear your baby. Now, another problem that can make a woman suffer from infertility is structural problems with your fallopian tubes, uterus, or the ovaries. Like I said earlier on, fallopian tube. Fallopian tube is a passage by which your ovaries travels and enters to your uterus. So now, when this fallopian tube is blocked, this fallopian tube is two. When it is blocked, it becomes a problem. Okay, it becomes a problem for you to conceive. Now, what can make your fallopian tubes to be blocked. PID can make your fallopian tubes to be blocked. That's pelvic inflammatory diseases. When this disease travel, they travel all the way from your reproductive organs to your fallopian tubes. They will now block all those places. They will fill it with scars. Okay? They'll fill it with scars. It can end up being blocked. That's why when you go for HSG, it is confirmed that, madam, your tubes are blocked. And you have to try to unblock them so that you can be able to get pregnant. Okay? That's why we keep on hitting it. We keep on hitting the nail on the head, telling you whenever you have an infection, treat it though, so that it will not accumulate and cause PID. Because when the fallopian tubes are blocked, I don't see any magic of you becoming pregnant, because it needs to be opened. Because if it is blocked, there is no way it will be opened. Now, the uterus, having a problem with your uterus. Some people have some problems with the uterus. So many persons might have undergone some problems in the maybe before. And what are those kind of problems? Maybe evacuation. So many persons, they must have had what you call miscarriage, and they went to a doctor. The doctor will now say, okay, madam, oh, you need to do an evacuation. And many doctors don't really know how to do this evacuation. Evacuation is just like cleaning your womb, cleansing it. So at the end, some persons might end up causing a bigger problem tomorrow for you, and end up causing a bigger problem. And when this evacuation takes place, for a zygote to grow or develop in there becomes a problem. Okay, becomes a problem. And so many persons have anteverted uterus. Okay, which you also need to retroverted uterus, which you also need to correct so that they can be able to get pregnant. Now, ovaries. Another problem is what? If you have a problem with your ovaries, there's what we call polycystic ovarian syndrome. There's also what we call ovarian cyst. When you're having these problems, it will be difficult for you to conceive or bear a child. It will be difficult for you to conceive or bear a child. So that is why, as a woman, from time to time, endeavor to go to the hospital. You may not necessarily be sick. You may not necessarily be lying on the bed or be totally down for you to go to the hospital. Once in a while, go to the hospital, run a routine check on your body to know if everything is working perfectly well. Then if you find out there is a particular problem, do well to see a doctor. When you see a doctor, the doctor will give you a proper advice on what to do. The doctor will give you a proper advice on what to do. So these are the things that can make a woman suffer infertility tomorrow. And also, I talked about the unhealthy practices that can cause infertility in the life of a woman or in the life of a man. So if you have any questions, do well to drop it in the comment section, as we will be answering those questions. And some people find it difficult to understand their body system. The male reproductive organ is quite different from the female reproductive organ. The way it works is quite different from the way it works in female. And we female, we have delicate organs. We have delicate organs which you need to be mindful of, which you need to like put your eyes very well down. Okay? The men, they have some body parts, they have scrotum, they have epididymis, they have vas deferens. We women, we have our ovaries, we have our uterus, we have our ovaries, so many of them. So the way the body of a woman works is quite different from the way the body of a man works. So that's why as a man, as a woman, as a woman rather, you need to always look at yourself very well. If you notice some changes in your body system, look well to try to tackle it, not leaving it once in a while, and when everything accumulates and it now becomes a problem, we now expect magic to happen in 1 month. Some persons will have one problem or the other. Some persons might have ovarian cyst. Some persons might have endometriosis, and these problems could have been corrected with time when it was found out, but because of negligence, they will leave it. When it now accumulates, you will now bring it to a doctor, and when the doctor tells you that you can be able to treat it in 2 months, you'll be like, 2 months, is that not small? Why I need action, I need a result in 1 month. How is that possible? Nobody does magic. So you need to take proper care of yourself as a woman. So having said all of that, if you have any questions, drop it, as we will be answering the questions from the comment section. So if you have any question, drop it, we'll answer you, okay? Like I said earlier on, what we're talking about, unhealthy practices that leads to infertility, and also some specific factors that can make a woman suffer infertility tomorrow. So do well to drop your questions in the comment section. So as a woman, so that you don't even as a woman, so that you don't end up suffering what you don't know. Okay. Jesus factor incompatibility is not very, very conversant now. Like I said earlier on, couples go for tests for routine checkups before they get married, but a whole lot of persons don't know what Jesus factor is all about. They might tell you, doctor, no, so I've been having miscarriages. I've been having miscarriages, but yet they don't seem to understand or know why they're having miscarriages. If your Jesus factor does not match with that of your husband, it is a big wahala. It is a big problem in terms of reproduction. It is a big problem. You get, so that is why it is pertinent enough to know if yours matches with your husband. Then if it matches with your husband, fine and good, no problem about that. But if it doesn't match, it becomes a problem. But not to worry, there's always an injection given, Rogan injection. Immediately you give birth, Rogan injection will be given to you so that it will cleanse your blood and prepare you for another incoming babies. Okay? But now the injection is costly now, but not to worry, okay? It's affordable. It's also affordable. So that is what will be given to you so that you'll be able to carry your baby whenever you want to carry your baby. So don't fear or have some having some doubt in your mind. Okay, so do well to know all of these things. It's not only checking of genotype, checking of blood group, checking of STIs, checking of infections. No, no, no. Also check your rhesus factor. We ring this as a bell every day. We are trying to create awareness to people so that they're able to understand that there is what is called rhesus factor that needs to be checked. That needs to be checked immediately after uh, that needs to be checked immediately they want to get married or they want to conceive or bear a child. So, having said all of that, I think we are going to draw the curtain here for today's podcast. Having said having said a whole lot. So, in case you listen to it and you have any questions as regards to what we've talked about here, do well to drop it in the comment section as we'll be answering your questions. So thank you very much. Thank you for being with me here on the show. Thank you for being with me here on this podcast. I want to really, really appreciate you all for joining us today. And remember, we always do this every Friday and always do keep a date with us here. Same time, same place next week as we are bringing to you another interesting and mind-blowing topic, because every day we are doing a whole lot of researches. What do we need to talk about? What do we need to bring to people's ideas? What do we need to tell people so that they understand and will live a healthy lifestyle? That is what we are here to do. Okay, that is what we're here to do, bringing to you things, bringing to you ideas, bringing to you information that will help you live a healthy lifestyle. So until then, keep a date with us same time next week. I remain your humble host, Ms. Gift. Thank you for watching and live a healthy lifestyle. Bye.